Good morning, and thank you, Mr. Chairman and members of the committee, for the opportunity to testify today. My name is Nicholas Armstrong, and I am a policy analyst for the Center on Health and Families at the Texas Public Policy Foundation. And I'm here to testify in support of HB 997, which, as previously stated, would create a telehealth registry that would allow out-of-state healthcare providers to provide telehealth services across state lines. Under the current status quo, if a doctor in another state wants to practice across state lines, they have to go through the full licensing process to obtain a license in Texas. And obtaining a license in Texas can be an arduous and expensive process, which creates barriers for physicians who want to see patients but do not want to go through this licensing process. HB 997 would allow healthcare providers in good standing with their home state's licensing board to be issued a license to provide telehealth services in Texas so long as they register with the appropriate regulatory body in Texas and that they have not been subject to disciplinary matters in their own respective state. These providers would be subject to all the rules, regulations, and laws of Texas, and patients would be able to adjudicate and file any claims against those out-of-state providers if need be. This happened during COVID. Texas issued emergency orders that offered special licenses for those out-of-state providers, and more than 4.5 million Texans used telehealth for the first time, and 94% of those surveyed expressed that they would be willing to continue to use it in the future. Now, sadly, those emergency orders expired when COVID ended. And we've seen telehealth can improve healthcare access without compromising quality. Florida's telehealth reforms in 2019 have proven effective with bringing over 14,000 different providers successfully offering telehealth services without any significant breaches in care. And Texas can replicate this success by creating a telehealth registry. And this is a way for the legislature to bring in those providers right into the living room of those particular patients. Telehealth offers flexible solutions which are critical to addressing the provider shortage in underserved areas. Thank you for your time, and I look forward to any questions that you might have.
Yeah, thank you, members. Any questions?
Yeah, Mr.
Yeah, Vice Chair Busey.
Thank you, Mr. Chairman. Are you able to walk us through, you just said it's an arduous task to get the full licensing process. Can you compare what they have to do and what that timeline looks like if they're out of state right now through the current, and what it would look like under this bill so we can understand the differences here?
Yes, certainly. Thank you for the question. So there's a couple of different processes. So for the medical licensing compact, one particular way that could have barriers is, so to be a part of that licensing compact, you have to pay the initial fee to be a part of it, which is $700. And then through that board, you have to pay the licensing fee for whatever board that you want to practice within that state. So if you wanted to practice in all 4 states, you have to pay all 40 of those licensing fees. When I was looking at this recently, Texas has one of the highest cost for it, so it was $843. So you would be looking at somewhere north of $1,500 to come practice in Texas and take all of the other licensing exams and everything that Texas has to do in order to practice in Texas. So those are some of the potential barriers what makes it difficult to come practice in Texas.
Do you know how long that process usually takes someone right now?
No, sir, I do not, but I can find that out for you, and I can follow up with you or someone in your office.
You talked about 4.5 million users during COVID under the emergency orders. How many doctors from out of state were we using during COVID? Do you know for telehealth?
I don't know that, but I would be able to follow up with your office or anyone, yourself or anyone from your office if when I can find those numbers.
All right, thank you. Thank you, Mr. Chair.
Thank you, members. Any other questions? Yeah, Representative Cunningham.
So I'm going back to what the doctor said and just kind of putting everything together. So basically what we're doing now would be to circumvent what the compact already has in place.
I wouldn't necessarily say that it was circumvent. It's more of a both and. If individuals want to get licensed through the medical licensing compact, they're more than able to, but there are other states that are providing ways in addition to and not necessarily circumventing. It's a both and. Whichever one would be whichever one the provider would want to go through.